Hi, everybody. I am going to go ahead and just talk to you a little bit about infection prevention. I put the camera off my face because I'm actually doing this at home and I'm in my pajamas. Isn't that the wonder of working online? I wanted to just do a personal talk about infection prevention, not because I'm personally infected or anything, but I look back at my own career, and when I started doing my clinical practicums, it was in the early to mid 80s, and the AIDS epidemic was just beginning to be understood and in the news. And so I was right there on the forefront. One of my first patients that I had in the hospital was an AIDS patient. I was very afraid to work with him, but the humanity and the person that he was so amazing that I soon forgot about my fear. And so I want to frame this talk a little bit in that idea that behind the infection is an individual, and don't forget that piece. Right now, this is being recorded in the summer of, what is this, 2014, and we are hearing a lot of stories about the Ebola epidemic in Nigeria, and I think about some of those workers who unselfishly gave their lives and are still giving their lives in the face of these very awful diseases. And I know that some of you have been to Peru, and the infection prevention pieces there are not as stringent as we have here in the United States. They simply don't have the means. So I want, again, couch this chapter with that idea. The chapter talks about protection and how to stop the spread of infection. So we'll talk about why we do that, how different infections are transmitted, how to get a good hygiene plan, and then special situations. I don't think I need to belabor how important it is that we think about keeping ourselves safe, but you also need to think about what you're carrying with you. And what you're carrying with you can go to the next person. So there are new rules, new procedures that we will talk about, especially when we are talking about bodily fluid contact. One thing I do want to mention here is that we wear scrubs in our clinic, and of course we don't glove and gown when we see clients. We typically are working with people who are outpatients, so they have been deemed okay to be in society and to be circulating around. So we don't always have to glove and gown when we see our clients. That is so different in the hospitals. Many times you will go past a room of a patient you're going to work in, and you will see a whole glove and gown procedure that you need to follow. So just remember that we have different ways of protecting ourselves. One thing that always upset me a little bit when I worked in a hospital setting is you would see residents, you'd see speech language clinicians, you'd see nurses walk home in their scrubs. And I always thought, what in the world are you carrying home to your family? When you are in a hospital setting, there is hospital laundry, and typically the scrubs you wear you don't own. They are owned by the hospital, and I always felt very happy to take those things off, leave them in the hospital laundry, and go home in my own clothes. And I think that's something, if you do end up working in a hospital setting, to think about. Don't carry home what you have been working with. We know speech language pathologists and audiologists could be the source of infection. You can come to work sick, you can spread what you have to other people, or you can pick something up within the hospital room and take it to the next person. This word that you see here, nosocomial infections, they mean they are propagated in a healthcare setting. Nosocomial infections are something I would think of as a patient you'd be very angry to get, because that means you did not come in with that infection, you acquired it within the hospital. Sometimes you hear it as an acquired hospital infection, and that means that somebody in that system had a lapse and they breached the protocol and germs were transmitted. We get infections by microorganisms. That means we can't see them, but they can still travel. Microorganisms can live on your skin. They can be transmitted through the air. They can go through water. Even plants. Animals can carry microorganisms. You can get microorganisms in the soil and through people. Tetanus is a microorganism, and that's on my mind because I just had my tetanus booster and I am really sore, so you should have a little bit of feel bad for me. My arm had a really bad reaction from tetanus, a tetanus shot that I had 3 days ago. Man, it's been 3 days, and my right arm is all swelled, and it's like a hot red hard spot under the arm. And I think about that and I'm like, I wish I didn't have to have that tetanus booster. But if this is what the booster causes, think about what the actual disease would be like. The chain of infection, you have a source, you have a way that it transmits, so it goes through, and then you have a person or a host that is susceptible, and then the infection is opportunistic and it continues. We transmit infections or these microorganisms by touching another person with your hands, touching them with gloves that have an infection in them, so change your gloves between clients. Touching one infected client, then using the same hand or gloved hand to touch the oral area of yourself or another client. There can be inanimate objects like the bed rails or the blankets that you have covered your patient with, or anything in the room that you have touched, and then you go into another room. Coughing or sneezing, that's what we call airborne transmission. I know, for example, chickenpox and the influenza virus are transmitted that way. You can ingest contaminated food or water. You can contract a bite from an animal or an insect that will transmit a virus. One of the types of diseases that we talk about in this chapter is a staphylococcal, or you'll hear a staph infection. Staphylococcal infections don't come from one staff member to another. It is an actual bacteria. It can be simple and very localized, from a small infection in a wound to a serious infection in a wound. It can propagate. You've heard about the flesh-eating bacteria, pneumonia. Hep B, that's a virus. You should have all been immunized for Hep B, but that's transmitted via blood during sexual activity and from the mother to the baby. That's perinatal. HIV/AIDS, that's transmitted through body fluids. That includes blood, saliva, tears, nervous system tissue, breast milk, semen, etc. If somebody sneezes on you and you breathe in the droplets, you could get HIV. That's kind of a difficult way to get it, but it could happen. And look at table 22.1 for symptoms of HIV/AIDS. No, you probably don't have AIDS. I have had students come to me in fear that they acquired AIDS, and so far nobody has ever gotten it yet. The examples of communicable diseases: herpes simplex. Herpes is typically, you know a lot of people who have herpes. They have what they call cold sores on their lips, on their mouth, and their face. That's type 1. Type 2 is usually associated with a genital infection. You can acquire that through sex. Cytomegalovirus. I think I've talked with you all about this and scared you about it. It is a member of the herpes virus group and what we used to call, and we still call, the Epstein-Barr virus. It's transmitted primarily through bodily fluids. Let me just tell you a little bit more about that. Most of you have or will acquire cytomegalovirus. It's more like a cold. You see it a lot in daycares. Becomes important if you yourself are pregnant and you get for the very first time, if you get a cytomegalovirus. Many people get it several times over the course of their lives, but if you get CMV when you're pregnant, it can affect the unborn fetus. I urge you all, if you are, especially female, if you are of childbearing age, to talk to your doctor. They can do a blood titer to see if you have had cytomegalovirus. If you have, then there's no risk, or the risk is very minimal if should you get pregnant and then acquire the virus. You've already had your first exposure. If you have not had your first exposure to cytomegalovirus and you do plan to become a childbearing person, be very, very careful that you do not acquire CMV during your pregnancy. I have seen babies born with mild issues to very severe mental retardation and profound deafness acquiring CMV as they were in the fetus of a mother who got CMV for the very first time. Tuberculosis, that's a bacterial infection. It is mycobacterium, and we do have situations now where there are some TB bacteria that are really not responding well to our antibiotics. We get periodic TB tests, and so you need to be aware of that and make sure that if you do have any type of reaction, that you get treated as soon as possible. Scabies, believe it or not, in the schools, that is one thing that tends to go around. It's an infectious skin rash. It is a mite. It's a mite that gets in the skin, and if you have skin-to-skin contact, those little mites burrow in. Scabies tend to show in areas where you get warm, so on your belly, if you get warm in between your arms and legs, those are the first, or in between your arms where your elbow, where you bend that joint. Any place that tends to be warmer than other parts of your body, and you have to be treated with kind of a pesticide in a way for that. We've talked about influenza, and I think infection control for influenza is something we have to battle every season. In wherever you work as a speech language pathologist, there should be some type of a policy that deals with infection control. And the purpose for that policy is to minimize the potential for transmission. Wherever you end up working, there may be a short training that you go through. Many times this training will be to increase your awareness of infection and to know your department's management plans for minimizing infection. You have to kind of know what these plans are, know how to and when to report incidents of infection, and take action. Many times you will go through a pretty extensive pre-employment screening. You'll have orientation, and you'll learn the protocols for that environment. The goal is for a limited exposure to infectious agents, hand washing, and look at tables 22 and 23 for the guidelines, and respiratory etiquette. Many times that's the sneeze into the crook of your arm. You will have at some point personalized protective equipment that can be glove, gown, masks. There will be a way to decontaminate and to regulate the waste and separate people with infectious diseases. That is all I'm going to talk about at this point. Finish the chapter. Go through that, finish the quiz, and you will be done. Thank you so much.